Cool, thank you for that mood. And I think it's safe to say that things have grown a lot in relation to sustainability over the last 5 years or so in particular. So there's been a lot around for 10, 15 years. But over the last 5 years, I think it's, from my personal perspective, we've just seen more and more and more around the urgency and the need for change in relation to climate change and wider environmental challenges, particularly because of the impact it has on our patients. And I think that's coming through more and more and more. And I think so. I lead the Care Without Carbon team, which is based in Sussex Community, so based in the local community trust. But we work with pretty much all the NHS providers in Sussex and some further afield in Surrey and further to either support and deliver sustainability programmes or one-off projects. So we're in quite an interesting position as a team, and we're about 12 in number now, so quite large, which enables us to have a good perspective of what this looks like in practice on the ground for providers across the board, so whether that's community, mental health, acute, and beginning more work in primary care. But also it allows us to develop specialist knowledge and expertise within the team. So we have specialists in energy, in travel, in sustainable procurement, in engagement, and that's only possible because of the way that we're set up. But actually, because of the nature of the challenges around sustainability, it's also really critical, because actually sustainability is a huge challenge and covers a range of different areas. So just a bit of background is just a sort of that we are kind of at this current moment in time working towards the NHS England Climate Change Strategy, which was released a couple of years ago, and it required all NHS trusts to meet this target of net zero by 2040 for our direct emissions, 2045 for indirect carbon emissions. So that's the kind of critical target that within the NHS we're all working towards. But within that strategy and within the Health and Care Act last year, it was firmed up that it wasn't just about net zero, but also the climate adaptation was really critical, and other environmental challenges that are linked to the environment, so biodiversity, air pollution, water and waste, are also really critical. And I think the three aspects here are the way that we're currently delivering care in the NHS is negatively impacting our health, and we have to do something about that. And that kind of covers that first aspect. But the climate adaptation piece is one which I think is becoming more and more prevalent and obvious in terms of the need, which is to say that actually it's our patient populations, our communities that we work with directly that are most impacted by climate change day to day now and will be in the future. So, and I think it was really interesting to see your slide around the kind of research priorities, because they all feel so very interlinked. So, health inequality, prevention, digital, sustainability, and the clinical piece, they're all really linked. I'll be interested to see whether there's going to be work to show that in practice. So can we measure the sustainability impact of our prevention programme? Can we measure the public health impact of our sustainability and all those sorts of things? So hugely linked. And so I think, one of the challenges though with sustainability that I've kind of alluded to is knowing where to start, and that's where some of this research is really critical, because as a team we're in a position where we're trying to kind of take policy and implement it in practice, but we don't know how to do that in many cases. So the research is critical, both that comes from the teams on the ground looking at that real detail, but we also have to do our own research, and again that's something that we've developed over time as well. But key to all of our work is kind of starting with the data, and again it's kind of there's no point in fiddling around on the edges doing a little bit around recycling here or something about engagement here if actually we're not getting to the nub of the issue. We've got such finite resource to tackle sustainability, and we need to do it right. So data is critical. At organisational level, we can sort of set, so you can understand your total carbon footprint, and you can set your net zero trajectory and say this is where we are now, this is where we need to be, and that's the line that we have to follow. But you've got to go deeper, of course. So what does your actual footprint look like year on year? And this is an example of what that might look like. So we've talked about energy, we've talked about travel, but actually supply chain, 73% of our carbon footprint on an average level. This is Sussex Community's footprint from a couple of years ago. But it gives you a sense, and there's a huge amount of different aspects to tackle. So that's kind of at organisational level of footprint. But what do you do with that 75% figure? How do you break that down to understand what to do about it? So this is an example of where we've taken that further to look at carbon hotspotting. So we're trying to say, in this case, actually, we're looking at different sites to say, actually, let's look at on a per site basis what does carbon footprint look like. So could we tackle it on a per site basis? but you can also tackle it at a departmental level. So which are your highest carbon hotspots in terms of services? We've heard about surgery being a big one, but for a community trust, which are our highest carbon impact services? Shall we start there to work out how to tackle it? But there are then other types of data as well that are really critical. One thing we've done recently is develop a climate impact assessment for Sussex to say what are the impacts of climate change going to be on our patient population, which of our population sectors are going to be most impacted and how. And then the next question for us, of course, is how do we do something about it? So how do we work with our services to understand how they need to adapt? How do we adapt our buildings? And this is kind of all on the basis that actually within healthcare we need to be the last service standing when you know, we're hit by extreme weather and all those sorts of things, because there aren't going to be other options for people. Finally, I just wanted to highlight some other types of kind of research and data that we've done. We've talked quite a lot about patient focus here, and we did some research a couple of years ago with a patient focus on the basis that we know that in sustainability we have to make changes that will impact people, impact our patients, whether it's, you know, changing medication or changing the types of food that we're providing in hospitals. So we went out to patients to understand their views on that, what they thought was going to be okay, what's their starting point, and that will help us then to develop practical projects on the ground to say what do we actually do about it. So, I'm talking about kind of challenges and opportunities. Resourcing, critical challenge, this will be familiar to everyone. So whether that's kind of capital and revenue funding for delivering projects, whether that's time available, so having the people in place to deliver sustainability programs, and also the skills. That is it's a really growing area, but we don't have many people that actually have the skill set to deliver it. And we've talked about sort of skill set in relation to research generally, so this is familiar, but these are also kind of circular because, you know, for example, do you spend your time on chasing the money, on applying for grant fundings? Because that means you can't then be doing delivery necessarily. So what's the right balance? And one of the things that we've had to do a lot of over the last actually sort of 6 to 12 months has been a sort of critical prioritisation exercise. So how do we prioritise? We've got a big long action plan. We wrote that 2 years ago. We knew we had loads to do, but we've only got so much resource. So what's the most critical factor that we need to tackle? What we worked out was that a simple kind of ease impact analysis was not going to cut the mustard here, because it's just everything comes out as high impact and, you know, either easy or difficult. But so actually we had to develop our own methodology for doing that. So it was based certainly on environmental impact, key critical environmental challenges, but we also needed to consider other aspects. So what was the patient impact? How much does it cost? Is it an organisational priority or a focus? And these different aspects have enabled us to develop an action plan which is actually really strongly prioritised, so that we know that if we've got one role in place, this is what we can deliver. If we've got 2 roles in place, this is what we can deliver. And that enables us to kind of to be delivering it in the most effective way possible. I'll go through these next ones quickly because I don't want to go over time, but the next one I want to just to quickly talk about is integration into core business, because we can see our carbon footprint here. We know there's a lot we can do in, you know, estates and facilities departments to tackle energy, in our logistics team to reduce our travel, but actually 80% of our footprint is driven by clinical decisions. So it's really critical that we are integrating our work across an entire organisation. We can't deliver it in one team alone. It has to be truly cross-organisational. And actually, same as any kind of transformational change, this is all about how we get sustainable thinking into day-to-day decision making in a way that feels possible amongst a huge range of other, you know, critical challenges in the NHS. We know there's so much going on, so how can we get sustainability in there? It's sort of about really how are we delivering on our NHS Trust visions in the context of climate change. So how can we continue to deliver high quality patient care in the context of climate change? We've done quite a bit around that. I won't go into detail, but one of the sort of critical aspects of this for us has been engaging hearts and minds. So again, it's not necessarily something that will be the carbon winner immediately, but actually we can get people on board across an organisation or indeed across an ICS, then that starts to filter through this generalised knowledge and understanding, which will help us to meet our targets in the end. We launched a new staff engagement campaign across Sussex, so amongst all the ICS NHS providers. called Together to Zero last month. Have a look at our website, carewithoutcarbon.org. Sign up. We're asking all staff across the NHS to pledge their support to delivering net zero in Sussex, so supporting their organisation to deliver their own green plans, and that will be followed over the course of the next 12 months with information and support as to how to do that in practice. And there's lots of resources and tools on our website which is publicly accessible to support NHS staff to do just that. And here's some of our NHS boards getting on board across the patch, which has been great. But obviously you also need this deeper level in management. So the high level stuff is great, but you need to translate that into activity on the ground. And we've developed, as part of that, a green impact assessment tool to help frontline staff effectively to understand if they're doing a change project, if they're in the process of an improvement project, what can they consider from a sustainability perspective to improve outcomes from that sustainability perspective. And then finally, the last thing I just wanted to touch on is the importance of working across trust borders, and actually this is a critical message that we're coming out with overall in terms of research is actually we can't do this alone. The way that we're set up within Care Without Carbon, we've got huge benefit in already being able to see what this looks like across a number of different organisations and learn from that. That's about sharing learning, it's about avoiding duplication, and it's also about using our influence to affect greater change. So our voice together as a group of NHS trusts, to our suppliers to say this is not okay in relation to labour rights issues or whatever that might look like, is much greater than individually. And I think that's where the sort of future opportunities also lie, in really getting that deeper integration into clinical practice. How do we do it? And it's sort of also about how we make that leap between the kind of detailed work that Chantal and others are doing on that level of carbon footprinting with the level we're at organisational level, where we know what the key service area is, but we can't necessarily make that leap between the two. So I think it's all about, for us, in terms of next steps, clinical integration. Now we can go much deeper and faster.